Hello, my name is Mark Allen. I'm currently the examination chair of the American Board of Thoracic Surgery.
The purpose of this presentation is to explain the examination process and to give you some tips on how to do your best on the examination. The focus of the oral examination includes data collection, interpretation of clinical information, problem solving, and the ability to explain your rationale for your therapeutic choices. The examination is given once a year in Chicago. It's given over a 2-day period with 7 different sessions, and you'll be assigned to one of the sessions. The examiners are all volunteer. They're taking times out of their lives to ensure high-quality care by thoracic surgeons. Examiners include members of the Board of Thoracic Surgery and other guest examiners who are experts in the field of thoracic surgery. I would advise you to arrive early for the examination process and proceed to the orientation room with plenty of time to spare. You'll be given an ID badge and a schedule of your examination. Please don't bring any cell phones or other electronic devices, notes, or papers to the examination. After the orientation is completed, you'll proceed to your first room on your schedule. The exam consists of 3 rooms, each of 30 minutes in duration. In one room, you'll be examined by 2 general thoracic surgeons, each giving you 2 scenarios for a total of 4 different scenarios in the room. In another room, you'll be examined by 2 cardiac surgeons, each giving you 2 scenarios for a total of 4 scenarios in that room. A third room is categorized as a mixed room and has 1 cardiac and 1 general thoracic examiner. Again, you'll be given 2 scenarios from each examiner for a total of 4 scenarios in that room. The distribution of the examination rooms is random, so yours may not appear in the same order as shown here. Examination topics include a broad base of thoracic surgery and include lung, esophagus, chest wall, mediastinum, trachea, pleura, ischemic heart disease, valvular heart disease, great vessel disease, cardiopulmonary bypass, congenital heart disease, and critical care. To pass the examination, you must pass 2 of the 3 cardiac examiners and 2 of the 3 general thoracic surgery examiners. The passing candidate would be able to integrate the history and physical findings, order only the necessary tests, choose safe and effective treatment options, understanding when operative intervention is not the best option, react promptly to unexpected changes in a patient's condition, demonstrate knowledge of the technical details of the operative procedure, and recognize and appropriately handle complications and ethical dilemmas if they arise. At the completion of the examination, you must return to the debriefing room, where you can complete evaluations to allow us to improve the process and fill out a change of address form if that would be necessary. The results for the examination will be mailed to you in several weeks. Please do not call the board office, for they cannot release the results of the examination over the telephone. We understand that the examination is a stressful situation. Try to relax and do your best. The examiners are trained not to be threatening and have undergone a thorough orientation to try to put you at ease. If you do poorly on one scenario, move on. The best action for doing poorly on one scenario is to do better on the next scenario. When asked a question about a patient scenario, ask for pertinent findings. Don't just ask for every possible test. Be expected to provide a differential diagnosis for the patient. Explain the appropriate management and how you would proceed with the patient's care, and know how to manage complications that may arise from your therapy. If the examiner does question your answer, it may not mean that you are wrong. They just want you to justify your response. The examiners will not provide feedback. You may see visuals or x-rays during the examination. Interpret them as you would as if you were in your hospital caring for a patient. Be concise and efficient. Time is limited. There's only 7 minutes per scenario, so just get the information that you need, not every detail. Try not to stall. Stay logical. Don't rush to the operating room before collecting the appropriate data. Some questions you won't know the answer to. Don't bluff. If you don't know the answer, do not make things up. Say, "I don't know," and move on. The American Board of Thoracic Surgery directors and the staff work very hard to make the examination fair. It is a demanding examination, and that is because it must ensure the public is safe. I hope you find this orientation useful and of value. If you have further questions, please go to the ABTS website at www.abts.org. Thank you.